and health education, and then I got my doctorate in physical therapy from Howard University, and then I went on to specialize in pelvic floor rehabilitation. Does anyone know what that is, pelvic floor rehab? Maybe a few people. Don't be afraid, they're all girls in here except for one person over here taking pictures. So ignore him, ignore him. Let me just tell the story about how I got into it really quickly. If you've heard the story before, give me a courtesy laugh, okay? So I was in PT school, and if you're in the healthcare field, you know that you have to get a clinical rotation. So I lived in Washington, D.C., where Howard University is, and I was like, I am not paying rent in this expensive behind city. Let's get kind of down south some more, right? So that I can afford this rent as a broke college student. And so I saw that women's health therapy at the time, that was the name for it, was on the list. So I was like, okay, for Long Beach, not too bad. Yeah, kind of bad when you're driving there every day, right, from Pensacola. But I was awarded a clinical rotation there. So I show up the first day, and my clinical instructor's like, just glove up and follow my lead. I'm like, glove up? Okay, all right. So I'm like, okay, I'm a little nervous, but I'm intrigued. So I walk behind her in the room, and it is actually a naked gentleman on the table. And, yeah, right? Oh, okay. Whoa. So his story was that he parachuted out of the plane. He was in the military, and his airbag didn't deploy properly, and he landed on his tailbone. And since that happened, he had all kinds of pelvic issues, urinary issues, tailbone pain, of course, sexual dysfunction, all of those things. That was my very first patient as a women's health or pelvic floor therapist, and I fell in love with it. I know it sounds kind of crazy, right? But I fell in love with it because it makes you think. This career field makes you think, because this is the most intimate area that we are treating, and it actually bleeds into every aspect of life. Intimacy, how you feel about yourself, all of those things. And so I actually went back to DC ready to go, like, this is what I'm gonna do. But I couldn't find a job in it because it's not a field that a lot of people do and want to go into. And so I actually went into inpatient care. So a lot of people trach and ventilators. And I have several stories about that. Let's go out later and we'll talk about some of the things I saw. But I kind of got bored with that. And then I went into pediatrics until one day, one of my kiddos, he was about 7, we were going up the stairs. He did not want to go up the stairs. So I came down the stairs and I said, come on, bud, let's go. Next thing I know, I'm dripping with blood everywhere. Leaking blood everywhere. And at that moment, I was like, Justine, your passion is in women's health and pelvic floor therapy. Let's do that. Because it's getting a little wild, right? And so I had the background in inpatient care. I had the background in orthopedic care, pediatrics, and I decided to start my own practice, of which many told me not to do. So I moved home and I started In Her Physique Pelvic Floor Therapy in 2018, where we serve all persons, men, women, and children for all pelvic floor conditions. And we'll get in a little bit of pelvic floor today. I won't bore you too much with it and nerd out. But men, women, and children struggle with things like leakage, constipation, pain. And we're going to talk about the impact of having health conditions and how it bleeds into our life and our wellness and our well-being today. So take a look at this Skittle that you guys have. See it? See how big it is? It's about 1 centimeter to 1.5 centimeters. I remember going to the urgent care, thinking I had the flu, and I stood above the toilet in the bathroom at Baptist Urgent Care, and an ant mound, a humongous ant mound of clots fell out of my body when I went to the restroom. And I went back in the back when they called my name, and I was like, hey, this kind of happened to me when I was in the bathroom, what do you think? And they looked at me and they said, I think you're having a miscarriage. Do you want to take a test and see if that's what's happening? And I was like, no, I think I got the flu or COVID. Let's just take this test so I can feel better. Not knowing that I had a fibroid the size of this Skittle inside of my body, causing me to clot. So, fast forward about, I don't know, a month later, because you know it takes forever to get in, right? I went in and my doctor did an ultrasound and was like, that's gotta come out. And I was like, no, I've never had surgery before except getting my wisdom teeth pulled. That didn't go great. So I was like, no thanks. But I went home and I waited a little bit longer and I was doing pelvic exams, hemorrhaging at my office in the middle of them serving patients. I had to leave work early. I started to not even want my husband to look at me because I'm like, this could have consequences, big ones. Children have not come yet, so what is that gonna look like? I had all these things that started to weigh me down. And I was not my best self. I was not my best self. So I decided to have the surgery. And guess what? I got more fibroids after that.
Yeah.
They just keep coming and being very disruptive. But what I've learned over time is that adding small things into my life has allowed me to manage the difficulties a little bit better. So I want to enlighten you today on some of those things. So I want you to take away just a few things today. I want you to take away the thought process, auditing your general well-being. So we're going to do a quick activity for that. Women's health in general, what is the pelvic floor, what to look out for? You know, for me, I treated hundreds and hundreds of patients over the last 6 to 7 years. And everyone looks different, but when you do the same job every single day, it becomes a little mundane. So having fibroids actually woke me up to be more empathetic with my patients. So what are some things that you can reignite your passion for serving others, because that's why we're here, right? And then trauma, what that looks like when it manifests itself within the body. So when we talk about people who are powerful women who prioritize health, I think of someone like Michelle Obama. Have you seen how she dresses? She's a bad mama jamma. I looked at one of her outfits though online, and it's a little bit above my tax bracket. When we're talking about a romper that may look like this that I got from Ross Dress for Less for about 30 bucks. Thank you. Hers is probably 3,000. So we're working on that. We're working on that over time. But she's much more than a first lady. She really is all about nutrition and movement. And so she does a really great job. She goes on interviews and talks about it all the time. So she's a great example. Anybody know the Huffington Post? No? Yeah? You know the Huffington Post, right? Okay. Ariana Huffington, high stress. She's big on burnout. Has anyone in the room experienced burnout before? Y'all are giggling because y'all might be burned out right now. Yeah. But she's a great example of promoting self-care. And this one right here, all the snaps. And the only reason is her story is similar to mine. She was birthing her daughter, and when she was in the hospital laboring, she said, I don't feel good. And they didn't take it seriously. She had a history of blood clots. And she actually was throwing another blood clot, and I hate that loose language, but she was having a blood clot during this delivery process. And she had to fight for them to hear her voice, and it saved her life. So advocating for yourself within the healthcare space is power. So I put her on here, one, because identify, but I mean, we look at her and I think she wouldn't even have any of those types of issues. She's so powerful, she's so strong, she's the GOAT, right? But we're human, no matter what. We're human first. Okay, we're gonna audit our wellness. So I'm gonna give you guys like 2 or 3 minutes. I want you to look at this chart here. These are all of the areas of wellness that I want. Take a picture, take a picture and come back to it later, because I want you really to take this information and think about it. These are all of the kind of categories that make up our wellness. So emotional, occupational, spiritual, intellectual, that's a big one. Intellectual, I don't think we even think about how that stimulates or how we lack that stimulation in that area sometimes. I hear about it all the time from my single friends. They'll be like, he just doesn't stimulate me, my mind. We gotta move on. But it goes further than that. What are we reading? What are we putting in our bodies, right? Physical, social, financial. Financial is actually the #1 reported area that women feel frustrated the most with. So turn around to your table and then kind of share one area that you feel is really strong in your life, and then when you'd like to improve. Go for it. And for the one that you're weakest in, tell me one thing that you can do to improve that area when you find the one that you feel weakest in. Okay, ladies, what you got? Anybody brave enough to tell me what area that they would like to improve on and one area that they feel like they're strong in? Anybody willing to share today? Anybody? Okay, Anna. Okay, so Anna's gonna share today one area that she feels strongest in and one that she feels weakest in.
So I guess for me, one of the areas I feel pretty good in is social, and in quite a few groups. I get to see people a lot with my job and just with all the organizations I'm in. One area I really am looking to improve on is the financial area. Just, young adults still trying to figure it all out and see what I need to be doing, especially for retirement. A few years away, but need to think about it. One thing we did do recently is convince Cover's husband Jeff. He gave a nice investing talk to the Pensacola young professionals, and I was just saying that spurred me to kind of look into what my retirement things are that I already have through the university, and really start working, on that. So just going to one talk, and I'm like, oh my God, I didn't know about any of that. And then now I'm actually looking into it and actively trying to figure out what I should be doing.
Yeah, it's really awesome. So I hear using your resources, starting somewhere, using your resources, and that can really apply to all of those areas. So this is something that I think you should do more than once. You should do it as often as you think you need it, but at least once a month. Where are you, right? Where are you in these areas? We're gonna tie it in together. So pelvic health, why, and we'll talk about why this matters in a bit, but the pelvic floor is a 3-layered muscle bone. It starts at the front of your pelvic bone and attaches to your tailbone. So that's why I like to tell that story about my patient, because when you break that tailbone, all the muscles of your pelvic floor start there, and you can have all kinds of problems from things like that. And so the pelvic floor muscles don't hold our organs up. It just creates a supportive environment. So stable enough to make sure that you're not urinating on yourself, but also flexible enough that nothing hurts, right? And I like to say that I can have 2 patients that come to see me that leak urine, We do a pelvic exam on them, and they may leak urine at any point when they cough, sneeze, laugh on the way to the restroom, bending down to pick their toddler up, whatever like that. But I can do a pelvic exam on 2 women that have the same complaint. And the reason why they're leaking is different. Some people can have a very tight pelvic floor, and some people can have a very weak pelvic floor, but both leak urine. So I say that, even physicians that I'm friends with will still say, hey, do 100 Kegels a day, or 17 magazine, or whatever popular magazine will say, do your Kegels. But a Kegel is an active muscle contraction. So when I flex my bicep like this, right, that's a muscle contraction. So why would I walk around and do 100 flexes of my bicep every day, all day? I probably wouldn't do that. It would likely be very sore and tight after I do that. Same thing internally. So if you have questions about maybe where you stand with that, let me know. I gladly help guide you. And again, while at one point we were one of the only clinics in the area, we're not the only one now. So I encourage everyone to go find a pelvic floor place that you feel like you would like to go to based on insurance, based on location, things like that. And at least get an evaluation to see where you stand, especially if you don't know. So the job of the pelvic floor is to contract and relax, to lengthen and bulge, and to maintain tension because it's a shock absorber. It's involved in everything you do. When you breathe in through your nose, guess what the pelvic floor does? It relaxes. When you exhale, it lifts, and that's not something you do on volition. That's something that it does on its own. So a lot of times that pours it over into fitness too. I see a lot of patients that are in group fitness, and group fitness is like feeding the whole house, right? So sometimes it's high-paced, very fast, right? And so sometimes people need modifications depending on what's going on internally in order to participate properly. Okay, these are examples of different common pelvic floor issues. I do a lot of runners, so I add bowel issues in there for runners. A lot of runners have bowel issues, believe it or not. So bladder issues, urinary leakage, frequent urination, painful bladder when you urinate or feeling like just pressure there, constipation, diarrhea, hemorrhoids, urgency, leakage of bowel, all of those things are bowel issues that we treat. And pain, it should never hurt. It shouldn't hurt at your tailbone, it shouldn't hurt at your groin, it shouldn't hurt inside, it shouldn't hurt outside. So if it does, let's talk. Or find out why, what's happening. Sometimes it's hormonal. So my last Bella article was about menopause. So check that out as well, and perimenopause, if that's something that you may be experiencing. Another big thing that we do not think about is how the body stores trauma. And trauma looks different. And sometimes we don't think something is trauma when it is. So I like to always bring up big T versus little t. Have you ever heard of this theory before? Anybody? Okay, you've heard of it. So big T traumas are big things. Shootings, assault, car accident, huge trauma. Little t are things that happen on a day-to-day basis and pile up over time, right? So a breakup, the death of a pet, and sometimes the death of a pet, and all the small t's actually can be considered big trauma to some, but losing a job or getting bullied on the job, small t, and the difference really is that the big T traumas are life-threatening, whereas the other little ones, they create a response within our hormones, within our body, and our bodies have a difficult time recalibrating after that spike occurs, once the traumatic event occurs. So literally, being rejected, all of those things really, really matter, okay? And what the small t's, how they differ physically than the big T's, is that oftentimes the small t's are adding up over time. Then you see a big event happen in the body, a heart attack, muscle strain, headaches, things like that. Large T trauma is happening typically right then, right? Your body goes into overgoing mode right then, overworking mode right then. So physical signs, the fight or flight. I always mess that one up. Fright, flag, faint, and freeze. We always think fight or flight, but our body can do so much more than that. And there are so many different physical signs that are in each of those categories that you may not know of. Blood pressure increase, perspiration, actually the gut slowing down or speeding up, All of those different things can happen when these things are occurring. So your body actually physically responds to any form of trauma that you experience, whether big T or little t. God created us that way. The issue is for you to recognize it and to do something about it, okay? And it can further develop into things like hypervigilance, having to prove yourself and be in go mode all the time. That's me. I get people that come to me all the time like, how do you do all this stuff? You have all the stamina. Sometimes it's a PTSD response, honestly, right? But then other times it's just time management. But you gotta know the difference, right? And when you need help. Tension throughout the body is huge. I get a lot of patients that come to me that say, oh, my hips are so tight. And sometimes it isn't due to trauma, but other times it is. So those things are important to think about. Localized pain not caused by physical trauma. So if you have tension in your body and you don't know where it came from and it lasts more than 3 months, that's something to talk about and to think about. And disassociation, that's a huge one as well. Why does this even matter? Why are we even talking about these things? Because pelvic floor disorders interrupt our lives. My story about fibroids completely wrecked my life. I had to take over a month off of work. I was significantly depressed about it, fearful in my own body. I was afraid to do certain things, like take a walk. I was afraid, like, am I gonna make this worse? Am I gonna develop scar tissue? What's going on? So it's two sides in your mind that are going. One side that's functioning like normal, and the other side that's going through those other things we talk about, hypervigilance, freaking out, fear, worry. And then, and that is when the body starts to react. That's when the body starts to react. So other things happen as a result of the fibroids, hair falling out, those types of things come along with it. So pay attention to your body. Decreases your workplace productivity, the longevity of what you enjoy doing. Imagine what you enjoy doing being taken away as a result of a small thing in your life becoming so big, right? Those are things to think about. I'm wrapping it up. We go through this ladder though, you guys, so I'm not saying that when we have these stressful responses that's not a normal part of life. It's a guarantee. The issue is when we stay there too long. So think about where you are and how you feel within your body when you go up and down this ladder. When we feel safe, we're at ease, we're connected, we flow. We just flow. But when we're going through all of these other emotions that we're experiencing as a result of what we may be feeling in our body, it's all tied. The emotions, the physical manifestations, and the symptoms, they all flow together. So this is something to think about too. Kind of where are you on this ladder right now? Where are you? Are you safe? You're social? You ready to go? You ready to dance? You ready to rock? Right? Or are you just pushing through and showing up because it's a habit or an obligation? Think about that. Okay, so how to build resilience. We are running out of time, so this was another activity, but I want you to do this in your own time. I want you to discuss with someone you trust, setting boundaries and what that looks like for personal time and health. The point of doing that is it clears your space and makes things plain. Things being plain allows you to make better decisions. When you are able to be analytical with a fresh mindset, a clear, dejunced mindset, you're able to make better decisions for your life and your family. That is really, really, really important. Making rush decisions, uninformed decisions, all of those things play a role later, things to think about. And then managing stress in high pressure environments. I want you all to take the time to think about what you do now when you're in high pressure environments and what you would change about what you do in high pressure environments. What would you change about yourself? Would it be that you're able to breathe and slow your talking down? What does that look like? Whatever that looks like. And then remember that self-care is a non-negotiable. So going to the doctor is a non-negotiable. Eating well, non-negotiable. Okay? So those are two things I want you to remember and work on when you have your own personal time. Here's some other ones if you want to take a picture of this slide. Cognitive behavioral therapy is amazing. I did my research on it when I was in my doctorate program. It is something that you can ask your top providers, mental health providers, whether they do these techniques or not. EMDR and CBT actually are really, really awesome techniques for people who have endured trauma. Huge, huge, huge. Educate yourself, never stop. Read. Reading is huge. Please read or listen to audiobooks. Read and educate yourself. But there is a difference when we talk about healthcare. There's a difference between educating yourself to maybe prove a provider wrong versus educating yourself to be equipped to stand your own ground when you're in a room being presented new information that you may not understand. Okay? So those are things you can do to build resilience. And again, schedule those doctor visits. Take a break. Set a boundary. You do not have to be perfect to succeed. So thank you all so much for having me. I'm so grateful.
Thank you so much, Dr. Justine. We appreciate your time and the information. Obviously, it's very important for all of us to take care of our health, both physical, mental, emotional, and we thank you for educating us today. So again, thank you all for being here on our first fall luncheon. Do not forget that our next one is going to be a dinner meal or a dinner meeting. It is October 17th. It is here, and the emails will be going out with the link and everything to be able to RSVP. So thank you so much, ladies, for your time. Enjoy the rest of your Thursday and have a great weekend.
Thank you.